Today's topic will be on the new onset neurological disorders in pregnancy. Neurological disorders can occur in any age group, right from newborn to the geriatrics, but certain neurological disorders are common in women and are much more common during pregnancy. So, we will be seeing about the new onset of neurological disorders which can take place in pregnancy, and many of them may be very important to identify because they can turn critical. Acute neurological disorders which require hospitalization are rare in women of the childbearing age. Certain conditions are very unique to the pregnant person as well as the postpartum state. And we all know that the common ones are preeclampsia, eclampsia and delivery associated neuropathies. Some of the neurological disorders can be indirectly related to pregnancy, such as cerebral venous thrombosis, ischemic stroke and intracerebral hemorrhage. These three conditions can occur in any age group and any sex, but much more so during pregnancy. And nowadays, the age of pregnancy is increasing. With that, the complications of pregnancy is also more. And it is important to know these conditions as treatment options are very limited. We have to identify early and treat early. First, I will be speaking on the hypertensive disorders of pregnancy, also known as pregnancy-induced hypertension. We all associate this with eclampsia and preeclampsia. There is more to it than just that. The pregnancy-induced hypertension is classified into gestational hypertension, preeclampsia, eclampsia and superimposed preeclampsia. We will be seeing the differences between these four conditions. What is gestational hypertension? Here, it is increase in BP more than 140/90 for the first time in pregnancy. The person has never had hypertension, but now for the first time you are finding a BP which is more than 140/90. But then there is no proteinuria, and then this BP becomes normal within 2 weeks of the postpartum period. That is known as gestational hypertension. That is, first time the BP is increased during pregnancy, but is not associated with other signs or symptoms of eclampsia such as proteinuria or edema. And this BP normalizes 2 weeks postpartum. This is known as gestational hypertension, something similar to a gestational diabetes. Then preeclampsia. We all know this is increase in BP, that is a gestational hypertension, which is also associated with proteinuria, more than 300 milligrams for 24 hours and normalizes 2 weeks postpartum. What is preeclampsia? It is gestational hypertension plus proteinuria. Okay, next we will see what is eclampsia. This is preeclampsia with seizures. This is defined as the onset of convulsions in a woman who has pregnancy-induced hypertension along with proteinuria, and this cannot be attributed to other causes. Simply put, this is preeclampsia with seizures. Then the fourth one is, this is a very interesting one, and this we should definitely know. This is superimposed preeclampsia. What is this? This is of three types: pre-existing hypertension with new onset proteinuria, hypertension and proteinuria which progresses later, renal disease with proteinuria. See, the first one is pre-existing hypertension. Person already has hypertension but has new proteinuria during pregnancy, and this proteinuria is more than 300 milligrams for 24 hours, and this occurs 20 weeks post gestation. This is pre-existing hypertension, that is, the person is already hypertensive and now after 20 weeks of gestation develops new onset proteinuria. This condition is known as pre-existing hypertension with new onset proteinuria. Then the next condition is hypertension with proteinuria, which is documented before pregnancy or before 20 weeks of gestation. But then what happens is hypertension or proteinuria progresses after 20 weeks of gestation. So here proteinuria and hypertension are already present before pregnancy or in the first 20 weeks of pregnancy, but then one or both progress after 20 weeks of gestation. The third condition is renal disease with proteinuria. This can also be present in the pre-pregnant state or before 20 weeks of gestation, but then there is a new onset of hypertension after 20 weeks of gestation. So this is renal disease, proteinuria is already present, but hypertension comes on after 20 weeks of gestation. So you have these three conditions: pre-existing hypertension, proteinuria is new, and that is after 20 weeks of gestation. Here, second condition is hypertension, proteinuria, both are already present but are progressing after 20 weeks of gestation. Third is patient already has a renal disease with proteinuria but no hypertension, but hypertension comes on after 20 weeks of gestation. These are the 4 different types of pregnancy-induced hypertension, that is plain simple gestational hypertension, preeclampsia, eclampsia and superimposed preeclampsia.